Good day, students. Today, lecture number 5 for the 5th year of the Faculty of Medicine, fracture of the femur. Start. Classification. Fractures of the proximal femur, fractures of the head and neck of the femur bones, trochanteric fractures of the femur, ZhAL fractures of the femur, fractures of the condyles of the femur. Fractures of the head and neck of the femur occur mainly in elderly and senile age, 2 times more common on the woman than in a man. Mechanism of injury as a result of the fall on the great trochanter. Clinic and diagnostic. Pain in the hip joint, external rotation, limb shouldering, struck heel symptoms, violation of the Rosenthal line, Schumacher, lung, Brandt's lung, positive signs of Ellis and radiography. Typical limb position, external rotation on the left. Change in the position of the great trochanter on the Rosenthal line. Changing the position of the Schumacher line. Lung line with the fracture of the femoral neck and displacement of the greater trochanter upward this distance of the site of the fracture, T2, will be less than on the healthy side, T1. Ellis signs. The depression of definite above the greater trochanter on the side of the cervical or trochanteric fracture of the femur is greater than on the healthy side. For example, radiograph, fracture of the neck. At the right. Classification of fracture of the head according to LO, Association Osteosynthesis. C1.1, detachment of the round ligament. C1.2, detachment of the round ligament and bone fragment. C1.3, detachment of the round ligaments together with the bone fragment. C2.1, position posterior compression fracture. C2.2, anterior compression fracture. C2.3, compression fracture with splinting of the head. C3.1 compression fracture with detachment of the bone fragment and round ligament. C3.2 fracture of the head and subcapital fracture of the femoral neck. C3.3 compression fracture of the head and subcapital fracture of the femoral neck. For example, at the picture C11, C12, C13, and so on. Classification of neck fracture by ZhAL. B1, subcapital with a shift toward the adduction. B1.1 with the pronounced valgus more than 15%. B1.2 with mild valgus less than 15%. B1.3 without injection. B2 transcervical abduction fractures. B2.1 at the base of the neck. B2.2 in the middle of the neck. B2.3 in the middle of the neck with a shift. B3 subcapital fractures with displacement. B3.1 with slings, varus, and outward rotation. B3.2 with slates, vertical shortening, and outward rotation. B3.3 with a pronounced bias. For example, at the picture B1, B2, B3. Treatment. Conservative treatment, functional method, and skeleton traction. Surgical treatment. Internal osteosynthesis, open and so on, maybe closed, arthrodesis, and prosthetic total hemiarthroplastica, and compression distraction osteosynthesis, intertrochanteric osteotomy. For example, the picture skeleton traction. For example, osteosynthesis with a screw, we can use 3 screws. Osteosynthesis of fracture of the femoral neck with a dynamic hip screw DHS system, and screw at the X-ray picture. Shape of the osteosynthesis according to the Elizarov with the external fixation device. Endoprosthetics. Total endoprosthetic. Complication. Aseptic necrosis of the femoral head, false joints. Trochanteric fractures mostly occur in elderly and silently age, 2 times more common in women than men. Etiology: as a result of falling on the side or hitting the greater trochanter on a head surface. Classification: AO. Type 1. Type A. A1 trochanteric simple, A1.1 neck trochanteric, A1.2 trochanteric, A1.3 trochanteric displaced. Diaphyseal. A2 trochanteric, multisplintered. A2.1, one intermedial fragment. A2.2, two intermedial fragments. A2.3, more than two intermedial fragments. A3, intertrochanteric. A3.1, the reserve simple. A3.2, transverse simple. A3.3 with an additional fracture of the medial cortex. And the picture, for example. Clinical picture and diagnostics. Severe pain in the hip area, limb shortening, outward rotation, sharp painful palpation in the region of the great trochanter, radiograph. External fixation, external rotation, and the picture. Radiograph. Treatment. Conservative treatment. Skeleton traction 1.5 to 2 months. Functional method. Walking with crutches without support. Similar to 2 months. Surgical treatment. Internal osteosynthesis. Extrafocal osteosynthesis with an external fixation device. For example, internal osteosynthesis with an angular place. Transosseusis osteosynthesis with an external fixation device. Fractures of the diaphysis of the femur. Mechanism of injury. Arise from a strong direct impact on the diaphysis region on the sphinx. Classification: simple spiral, simple oblique, simple transverse, wedge spiral, wedge-shaped fragmentary, compound fracture spiral plus detailing, complex segmental, complex irregular. Typical displacements depending on the location of the fracture. Higher, typical, middle, and distal. Typical displays. Clinical and diagnostics. Pain in the area of the fracture, hip deformity, pathological mobility, bone crepitatus, outward rotation, Clemens symptoms, fold of the skin over the patella, and radiograph. For example, picture or radiograph, fracture femur at the middle. Treatment. Conservative treatment, skeleton traction, 6 to 8 weeks. Hip bandage, 8 to 10 weeks. More operation. Internal osteosynthesis, intramedullary osteosynthesis, extrafocal osteosynthesis with an external fixation device. Hip plaster cast. Skeleton traction. Internal osteosynthesis. For example, intramedullary osteosynthesis with a titanium rod with a blocking. Extrafocal osteosynthesis with external fixation device. Combination osteosynthesis. Screw or shunt and weld. For example, picture, osteosynthesis, external osteosynthesis. Fracture of the distal femur, mechanism of injury, with a strong deviation of the leg outward or inward. When falling from a height of a stretch tenured legs, with a direct blow to the lower third of the femur. Clinical picture and diagnosis. Pain in the knee joint, hemarthrosis, the contours of the joint and smoothed. Its circumference is increased. Ballooning of the patella and radiograph. Hemarthrosis is typical situation from intra-articular fracture femur, distal femur. For example, radiograph. Treatment. Conservative treatment, immobilization with a plaster cast and skeleton traction for tibial tuberosity from 1.5 to 2 months, and operative treatment. Bone osteosynthesis, intramedullary osteosynthesis, and extrafocal osteosynthesis. For example, immobilization and conservative treatment, bone osteosynthesis with a bone grafting. Extrafocal osteosynthesis with an external fixation device. For example, intramedullary osteosynthesis with a lockable nail. It's a start. Thank you very much for your attention. it's a finish